Knock knock, how are you?
Hello.
My name's Brianna. I'm the psychiatric nurse practitioner for the unit, and I was just coming by to touch base with you. Can you tell me what your name is?
Dion Foster.
Okay, and how old are you, Dion?
44.
Okay, do you identify as male or female?
Male.
Okay, and what's your ethnicity?
Black.
Okay, and what brings you in today?
Just depressed. A little depressed today.
A little bit depressed today.
Mm-hmm.
When did all this start?
Probably about a week ago.
About a week ago.
Mm-hmm.
Okay. And have you noticed any other symptoms with the depression?
No, I just don't want to do nothing. Mm-hmm.
Okay. And any other symptoms that you noticed with it?
No.
No, they're just feeling
Just down,
Down.
sad. Yeah.
okay. And what do you think is causing this depression that you're feeling?
Well, it's 3-year anniversary of my mother dying, so that just brings sadness on today's date.
That's understandable. I'm so sorry to hear that. So during my exam, while I'm hearing him talking about his symptoms, I'm noting his appearance and his behavior. First, we'll talk about his level of consciousness. His level of consciousness is alert. He's able to answer questions appropriately. He's a good historian. His posture is very slumped and down, just as we would expect of a depressed person. His motor behavior, he's sitting calmly and not fidgeting. His dress is appropriate. He's dressed according to what somebody will come into a clinic, and he's groomed well. His beard is lined nicely, and he has good hygiene. He has no body odor that I've noticed. Facial expressions are appropriate for the conversations that we're having, and his manner, he has a very pleasant manner to himself. His affect is appropriate, is a little bit blunted, which what I would expect for someone that is depressed and is down about their mother's death anniversary. His relationship with his mother must have been good because he's sad about that. His language and his speech, what I noticed, the quality is articulate and very clear. I could understand everything he was saying. The rate was steady. It wasn't too slow, it wasn't too fast, it was appropriate. The volume was a little bit soft. The fluency was very fluent, articulated the words very well, nice and clear. And I'm going to test for aphasia because that's what we want to look for in language when we're doing a mental status exam. So the test for aphasia, you're going to do, Dion, can you repeat after me? No ifs, ands, or buts.
No ifs, ands, or buts.
So he doesn't have aphasia because he can understand what I'm saying and he can speak clearly. Okay, now we're going to move on to the mood and affect. His affect seems a little bit indifferent and blunted, and some sadness, but no anxiety or anything, just more blunted and depressed. Thought process is logical, is well organized and coherent. So he was able to communicate to me that why he was depressed, and it made sense, it was logical. Thought content, didn't notice any abnormalities with the thought content. Could have possibly had some obsession about his mother's death because he said that it started about a week ago, and today's the day, so maybe he could be having some obsessive thoughts about his mother's death. Delusional, when it comes to his perception, no delusional thoughts or hallucinations. Insight, I would say, is good because he was able to acknowledge that he was having a problem with depression. That's why he came to the clinic